Well, I think in healthcare in particular, there's a lot of talk at the moment about being ethical. People in health are required to abide by a duty of confidence and everything else. The biggest problem seems that for some coming to the area, it's difficult for them to even comply with the law. The first principle is that any use of patients' data is lawful, fair and transparent. So if people were to start there, rather than trying to present themselves as the great new ethical champion, then maybe that would be the best thing. Well, I think what the work has shown is just how complex a pathway the process can be, from beginning to come up with ideas right the way through to developing something that may be usable by patients or by doctors for patients. And so what would probably help, given it's so disparate and disjointed at the moment, would be something as straightforward as having a consistent project identifier. What we see in the system at the moment is that things going off to maybe find a particular approval are dealt with one body over here in one way, and then later in the process they have to go through a different process, and there's no overall way of seeing that this project has gone through each of the necessary steps. So this would be good, I think, for developers themselves, because there would be a clearer pathway. It'd be good for the regulators, because they could see where their fellow regulators or other bodies have already had a look at a project. And it would be overall good for patients in the healthcare system, because it would give a degree of transparency. Because in all of this, when you're developing something using data, it's really important that we know that everything has gone through the correct processes and has been correctly approved. Far easier if you can just look it up in one place rather than having to go all over the shop. I think that anyone working in healthcare using patient data needs to be building their system to ensure that it respects patient choice. So it needs to deal with the consensuality of the use of data. That's at the research and development end, but right the way through to when it is actually in use, in clinical use. They need to make sure that they are designing safe systems, and that's not just security, information security, that is actually thinking about all of the processes around the data that is being used. We've seen so many problems where people have misused or used data in an inappropriate way or an inappropriate setting, at a fairly early stage in a project, before there's actually a service or product being developed. And that can sour the entire development process. So be certain that you're using this, these correct protocols all the way through. And coming back to, you actually need to be transparent about this. If what you're doing is for the positive benefit of the health service and for patients, then of course, you're going to need people to know what is being done with their data. And again, that's all the way through the process, from research and development all the way through to actual live service. So consensual, safe and transparent is your foundation, and I think then people will actually find that they can develop things that are much more likely to integrate well with the way the health system works.